Welcome to the topic, assisted living versus community living versus hospice care. Now stick with me to the end and you'll find out exactly what you need to know about each of these important types of living facilities. But before we get started, I just want to personally invite you to subscribe to my YouTube channel. I really appreciate it when you do. I just want you to help me to grow my channel by clicking the subscribe button, and be sure and click the bell icon too, so you'll be notified every time I come out with a new video. Because if you like this content, I'm going to give you a lot more like it and even better. So thanks for subscribing, and now let's dig in. The need for assisted living facilities, community living services, or hospice care may come about gradually, taking place over years or decades. Or the need may arise suddenly, thrusting you into a new situation that is nerve-wracking and unpleasant. When our health deteriorates, whether as a result of a major illness or just because our bodies have worn out after so many years of living, this may happen quickly or gradually. Even though we are aware that this is an inevitable consequence of being human, it may be challenging to acknowledge and cope with the consequences. In today's world, when it comes to caregiving services, there are a wide and bewildering variety of choices and factors to consider, which may be quite daunting. This video explains 3 types of care that people commonly have questions about: hospice care, assisted living, and community living. First, hospice care. Hospice care services apply to people of any age who've been diagnosed with a disease that shortens their lifespan. The current prognosis when someone goes into hospice care is survival for at least another half a year after one enters care. The primary goals of hospice care are to offer high-quality pain treatment, nurturing of patients' emotional needs, as well as support for patients' spiritual needs. Hospice care enables terminally ill patients to spend their last days in peace and dignity. Hospice care is normally provided at the patient's residence, but it is also offered in long-term care institutions, such as hospitals, nursing homes, and also facilities dedicated to hospice care. Hospice care costs may be paid in whole or in part by a patient's private insurance plan, Medicaid, Medicare, or any combination of the 3. In hospice care, a focus is placed on working together as a team to provide the highest possible level of care across 3 distinct domains of need: physical, emotional, and spiritual. The team may consist of medical professionals, nurses, therapists, counselors, and clergy who will be on call 24 hours a day, 7 days a week to assist whenever required. In most cases, a member of the patient's family will serve as the point person on the hospice team, and this family head will manage all decisions about the care of the patient's loved one. Because this may be very taxing and stressful, family caregivers also get assistance and coaching on providing care for their loved ones as well as themselves. Assisted living. An assisted living facility is not a hospital, even though there will be caregivers working there to offer the required care to the residents. The atmosphere is more similar to that of a home, and residents are typically people who are still independent in terms of their mobility and cognitive function. Residents have access to various amenities, including food establishments, transit alternatives, fitness and educational programs, and more. Assisted living communities are often the first option for people as they age. There are around 1.2 million individuals in the United States residing in over 30,000 assisted living institutions. Individuals often spend between 2 and 3 years at an assisted living home before making the shift to a nursing home, which can offer higher levels of care. Nursing homes are necessary for seniors who are bedridden or have complicated medical therapy requirements. Next, community living. Community living services enable adults with a broad array of disabilities to get the assistance they need to live in an integrated community with adults who are not disabled. These programs often assist elderly individuals, but also younger adults with developmental impairments, behavioral issues, mental illness, sometimes multiple illnesses, or traumatic brain injury. So which one is right? Which one is best? Assisted living facilities are designed for senior adults who are no longer able to live independently because they need some level of assistance. Community living is designed to allow disabled adults of any age to live in an integrated environment with non-disabled adults. Hospice care is designed for patients nearing the end of their lives. You can review hospice care in the familiar surroundings. You can receive hospice care in the familiar surroundings of your home or in an assisted living facility or nursing home, a hospital, or a dedicated hospice care facility. Now, if you have any questions regarding the topic assisted living versus community living versus hospice care, feel free to comment below. We'll be happy to respond to your comments and questions. And also follow the steps below so that you can join my Facebook group or subscribe to my YouTube channel if you haven't already done that. Now, before we go, again, I want to personally invite you to subscribe to my YouTube channel, and I really appreciate it when you do. I just want to ask you to help me grow my channel by clicking the subscribe button. And be sure and click the bell icon too, so you'll be notified every time I come out with a new video. Because if you liked this content, I'm going to give you a lot more like it and even better. Thanks for subscribing, and thanks for watching.